What specific measures do you recommend that HIV clinicians and possibly dentists take to increase the probability of early detection of potential HPV-related oral and anal abnormalities?
There is a real epidemic of oral cancer caused by HPV, and the epidemic is more profound in HIV-infected people, specifically in HIV-infected MSMs. There is no standard mechanism to screen for oral cancer, HPV-related oral cancer, and specific guidelines have now come up stating that there really is no screening recommendation. One can look for HPV in the saliva through swish studies, and usually they use mouthwash of some sort. The individual kind of rinses his mouth for 10 seconds, spits it out, and that can be tested for HPV. If the HPV is positive, that specifically it's going to be HPV-16 primarily. If HPV-16 is positive, that is a good sign to me that the individual really should be seen by a dentist in a very regular way, perhaps every 6 to 12 months, to look for particular lesions. The problem is that there is no equivalent Pap test for oral cancer, and the reason is that most of it develops in the tonsillar crypts, deep in the tonsillar crypts, and the brush that's used to pull off cells is on the surface of those crypts. So there's no real correlation between presence of HPV and any cytologic abnormality as in a positive or an abnormal Pap smear. So it's really a matter of looking at HPV, if you wish, by rinse, and then followed by a dental exam very, very carefully, looking for early lesions. It's important to do that simply because HPV-related head and neck cancer is curable. And in early stage disease, it's curable perhaps 90% of the time. Patients with HPV-related oral cancer do better than those who have regular HPV-negative head and neck cancer. In terms of screening or trying to prevent bad outcomes related to HPV anal cancer, there really are many things that can be done to try to prevent that. First of all, HPV testing of the anal area can easily be done, is done. It's done by as part of a Pap test, an anal Pap smear. And the anal Pap smears are done very similarly to a cervical Pap smear. One can look at the cells under the microscope to see if there's an early precancerous lesion. One can also use the same material to test for HPV. The problem with the Pap smear, the anal Pap smear, is that if it comes back as normal, that's fine, it's normal, and you can expect that or count on it. If, however, it comes back as atypical squamous cells of undetermined significance, that's called ascus, and that's thought to be just a reactive kind of lesion. However, if the Pap smear, anal Pap smear, comes back as ascus positive, the risk of high-grade anal precancer on biopsy is actually quite high. And so if an anal Pap smear comes back as ascus or low-grade precancer or high-grade precancer, all of those have to go forward to high-resolution anoscopy with biopsy. The biopsy is the definitive answer, so to speak. Patients with high-grade disease on biopsy probably will be treated at this point to prevent progression of disease. Those with low grade can be watched over time, and that test can be repeated in another year or each year. So anal cancer, we believe, may be preventable by screening. On the other hand, there's only one place in the United States, New York, which has stated officially that they are recommending anal screening to prevent the cancer. The United States in general has not come out with that recommendation yet. It's kind of a crazy deal, to tell you the truth, but if this were my patient, and they are, if this were me, I would absolutely, in an HIV-infected state, test for anal HPV and anal Pap, followed by biopsy if that anal Pap is anything other than normal.